osteoarthritis. Osteo means bone, so arthritis of the bone and cartilage, really. Also is known as degenerative joint disease, DJD. Typically, it's wear and tear arthritis. It means the more we're running, the more we're lifting, the more trauma to our joints, especially if we're traumatizing them as athletes, then typically that's a setup for arthritis down the road. And so those joints, that cartilage, especially in our back, you got to think of it like a tire. And when the tire is full, it's going to run pretty good down the road with your vehicle. But if it gets low, it isn't. And it's going to wear that tire and that rim out. And so if our disc space in our back don't have enough water, remember, 70% of everything in our body's water, our disc space, our joints. If we don't have that water, then the cushion collapses, and then we get that arthritis in our spine. Okay? It can infect any joints. Typically, it's hands, hips, knees, and back. And what are some of the symptoms? For some people, it's a steady ache, kind of a throbbing pain. Yeah, or it can be an occasional joint pain, maybe with overuse. Or some people, it's just morning stiffness, and it gets better when you move, getting back to motion, the lotion. Sometimes you can see people that have swollen or tender or deformities, bony deformities of their fingers, their wrists, and things along those lines. And it can be a mix of rheumatoid arthritis in there as well, which is an inflammatory arthritis. Osteo is inflammatory as well, but it isn't an autoimmune. It's not the body attacking itself like rheumatoid arthritis is. And so if we have a joint injury at a young age, like we have a cartilage injury or ligamentous injury in our knee or surgery, or a fracture through a joint in a wrist or elbow, you're 2 times more likely to develop osteoarthritis. If it's in your hip, 3 times, and if it's a knee injury, up to 5 times more chance to getting the arthritis.